Sanitize your treatment center every 4 weeks or after an extended period of non-use. Sanitation will help deter possible deposits on the walls of the water lines and effectively prevent the formation of a biofilm. Activate the function in the sub-menu of the Start dialog. Attach the instrument hoses of the dentist and assistant elements and the suction hoses to the designated adapters in the water unit. And then press Start. You can follow the progress of the individual steps on the Easy Touch. When it reaches step 4, the treatment center will automatically switch to standby mode. Allow the Dentocept S disinfecting agent to act for 24 to 72 hours. After switching on the treatment center, the Dentocept S is rinsed out of the instrument hoses and tumbler filling unit with water. Sanitation is completed with step 6, and the instruments and suction hoses can be returned to the dentist and assistant elements. If the level of disinfectant for the water lines is low, DES-INF is shown in the status line of the Easy Touch. Open the cover of the disinfectant tank and fill with Dentocept S. The disinfectant tank has a capacity of approximately 1.3 liters. It is full when the middle of the filling tunnel filter is visible. If the cleaning agent for cleaning the suction system level is low, Chem is displayed on the status line of the Easy Touch. Open the flap on the base of the water unit. Pull the tank out of the water unit slightly, paying attention to the hose line. Open the lid on the tank and pour in the cleaning agent. If the amalgam display appears in the status line of the Easy Touch, change the amalgam rotor. Open the flap on the base of the water unit. Loosen the bayonet catch by turning the lower part of the amalgam separator counterclockwise. Remove the lower part of the amalgam separator along with the amalgam rotor located inside it. Hold the lower part of the amalgam separator upright. Attach the transport cap to the amalgam rotor. Remove the amalgam rotor with a transport cap from the lower part of the amalgam separator. Place the container in the special packaging. Insert the new amalgam rotor in the lower part of the amalgam separator. Hold the lower part of the amalgam separator so that the latching noses of the bayonet catch are positioned transverse to the water unit. Screw the lower part of the amalgam separator into its upper part by turning clockwise. Close the flap on the water unit. Switch your treatment center off at the main switch to replace the water and air filters if you note changes in the media flows. Any remaining water will flow out of the water filter when it is opened. Because of this, you should place an absorbent cloth underneath the filter. Then remove the screw-on cap of the water and air filters and replace the filters. Close the flap on the water unit. Perform microbiological checks of the water from your treatment center at regular intervals. Allow water to run out of the syringe into the cuspidor for about 1 minute. Use the syringe to fill the test container with cold water to its upper fill line. To neutralize the disinfectant of the water sample, add approximately 1.5 grams of sodium thiosulfate. Immerse the tester into the filled container for approximately 30 seconds. The cardboard disc with the culture medium absorbs 1 milliliter of the water sample. Take the tester out of the container and shake off excess water. Then, empty the container. The result of the test provides information on the hygienic condition of the water.